A 20-year-old Singaporean man has died of dengue, becoming the first fatality in the current epidemic. The Ministry of Health and the National Environment Agency say this death highlights the urgency for greater community vigilance to stamp out mosquito breeding spots.
This is the last posting Mr Ang Yong Han left on his Facebook page. Admitted into Tan Tock Seng Hospital on Sunday, he said he hoped he would not have to go there again. But 3 days later, he died. The 20-year-old had initially gone to the hospital's emergency department on May 23rd. He was diagnosed as having a viral fever. As his condition was reported to be stable, he was discharged and told to return if his symptoms worsened. But Mr Ang's fever continued. He had also been vomiting. When he returned to the hospital, he was admitted as a dengue case. According to the Health Ministry, his condition took a turn for the worse. Despite medical interventions, he died. Family members of Mr Ang told reporters that his death was sudden because he died just a few days after being admitted. They say that his blood count platelets dropped to a dangerously low level in a matter of days. Questions still remain on their minds as to how his illness wasn't detected earlier. Those who knew Mr Ang said his future as an athlete was bright. As a pool player, he had just joined the national training squad.
I think it's a great loss for the community, the pool community, because I think character-wise, he's a very nice guy, and of course he has the potential to be one of the top players in Singapore also.
NEA is conducting thorough vector control operations at the vicinity of Mr Ang's residence in Hougang, which is a dengue cluster. Singapore is currently in the midst of a dengue fever outbreak. So far, more than 8,000 people this year have come down with the viral infection that spread by the Aedes mosquito.